everyone. My name is Anjum, and I'm a monitoring and evaluation lead at the Development Monitoring and Evaluation Office, or DMEO Niti Aayog. On behalf of DMEO, I'm delighted to welcome you to the fourth session of the DMEO Conversation Series. For those of you joining first time, DMEO Conversation Series is a platform aimed at bringing together leading monitoring and evaluation practitioners from the international development organizations, academia, think tanks, governments, NGOs, social enterprises, investors, and other private sector firms, including technology firms and CSR wings. And our goal is to discuss theory and emerging practices in the field of monitoring and evaluation. For DMEO, being the apex monitoring and evaluation office of Government of India, moving the current discourse of public policy in India to rigorous, scientific, evidence-based, and is realized as a vision. JPAL South Asia, our partner leading today's session, is the regional office of the Abdul Latif Jameel Poverty Action Lab, a global research center founded at MIT, striving to ensure policymaking is informed evidence through research, policy outreach, and training. It is host to Clear South Asia, Touch Policy South Asia, Centers for Learning and Evaluation Results Network, coordinated by World Bank's Independent Evaluation Group, and works to strengthen M&E systems and capacities and the use of evidence in the region. Today's session is a collaborative effort between the two organizations, and we will try to unpack the complexity of undertaking evaluation studies in the context of our policies, systems, and institutions. It is a manifestation of a common goal and commitment towards improving effectiveness of government programs and policies. Today, we will try to answer certain questions such as why do we need evaluations, which evaluation methodologies to use, and when is the right time to undertake evaluations, how to find the right set of evaluators, and how can institutional structures support high quality evaluations. We hope the session also raises unique questions of your own, and in that hope, we have a dedicated 15 minutes towards the end of the session to answer those questions. To lead us through the session, we have South Asia. And in this role, Megha leads efforts to strengthen monitoring and evaluation capacities and systems, and the use of evidence in the region through long-term government partnerships, trainings, and advisory services. Prior to joining JPAL South Asia in 2015, Megha was an assistant professor of economics at University of Delhi. She has also worked with the National Knowledge Commission, an advisory body to the Prime Minister of India. Megha holds a master's degree in economics from University. Before I have to, we will be taking questions towards the end of the session. However, you are welcome to post the questions throughout the session using the Q&A option, which is at the bottom right of your screen if you're logged in from your computer. Or if you're logged in from a mobile app, you can pull up the options from the bottom and you will see Q&A as an option. With that, I hand over to Megha to take us further in the session. Thank you. Over to you, Megha.
Thank you so much, Anjun. Am I audible?
Yes, you are.
Okay, perfect. So thank you, Anjum, for the introduction, and thank you to DMU for inviting me to talk about this really important topic. And I'm hoping that this is a very practical session for all of you, and you really go away with some key insights that you can apply to your work. And while the session itself is targeted, as you can see from the heading itself, it's targeted towards government evaluation strategies. I think the sort of principles that we're going to talk about are broad enough for these to also be relevant for other kinds of organizations. So for those of you not from the government, I still think that you'll find this session very useful. So Anjum is, Sabi from DMU is going to be working on the slides for me. So can you just move to the next slide? Great, thank you so much. So I think I'll just sort of set up the session a little bit and talk a little bit about evidence-based policy making. And I'm sure that most of you would agree that while we aspire for a world in which decisions are based on data and evidence, in reality, policies are often based on people's experiences, their ideologies, instincts, political constraints, financial constraints. And that's really the reason why an organization like JPAL exists, to ensure that we're able to bridge this gap and move from opinion-based policy making to policies and decisions that are really based on data and rigorous evidence. And we do this in three main ways: by conducting rigorous research, by disseminating this research to stakeholders, can apply to make crucial decisions, and this could be government stakeholders or NGOs or even donors. And third, we support partners in building M&E capacities and systems so that they become better users and producers of evidence. Next slide. And I know this may seem very obvious, and I'm sure that all of you believe that evaluations are important, but I do want to highlight this a little bit more. And so I think a very important thing to note is that at the end of the day, governments have finite budgets, and it's really all about making choices between different solutions that may exist. And so let me take an example here. I'm sure all of you are familiar with the learning crisis that's prevalent, not just in India, but also in other developing countries. And while we've seen increasing investment into education, we've seen that that's really not been accompanied by an increase in learning levels. And so the question for any policymaker, or as I said, even an NGO or a donor really is, how should I spend my resources so that I'm really able to move the needle on this outcome of interest? You know, we have done a lot of evaluations in the education sector, and I think what's really interesting is that there are a lot of surprising results that these evaluations have showed up. We found that there are lots of programs which may seem very sort of intuitively, they seem that they would work. So things like increasing resources on just inputs, right? So providing more textbooks, increasing the number of teachers, building more schools, in and of themselves, they do not improve learning outcomes. So that's something which, again, we would intuitively think that by just spending more on resources, there is going to be an improvement in learning outcomes, but that's something that rigorous research has not showed us. And on the other hand, we've also seen results where things which don't seem very obvious as solutions for education, so something like providing deworming pills to children, has in fact proved to be impactful on learning. So I think this is just an example to show how evaluations are important, and they can really give us surprising results and really help us in better utilization of resources and help us make better sort of trade-offs. Next slide. And so, as I said, I think all of us recognize that it is really important to evaluate both in terms of the learning that it brings to us, as well as in terms of improving accountability of organizations, of governments. But at the end of the day, we also recognize that evaluations are costly, they take time, they're complex. And so we need to be really strategic and think deeply about how we can evaluate the right questions at the right time and the right manner, so that all of this actually feeds into the decisions that we want to inform. And that's really going to be, so from this lens is where we're coming to the session, that how can we be more strategic in terms of our decisions to evaluate. Next slide. Great. So this is really an overview of what we're going to be doing over the next 45 minutes. We're going to be thinking about, these sort of main components of an evaluation strategy. And first is going to be, what do we evaluate? And really here we're going to delve into how we can think about what kind of evaluation we need to do to answer the right policy question. Because at the end of the day, it's not just about doing evaluations in and of themselves, but really trying to see how these answer the policy questions that we have in mind. The second component of this is going to be how we can actually choose from different methods, from different techniques that exist. And here, I think it's not just about thinking about sort of the technical criteria for choosing these methods, but even how can we be strategic, that when we are spending resources in doing evaluations, how can we think about the methods more from a strategic lens as well. And the third component that I'm going to talk about is who does the evaluation. And I know this is something that all of us grapple with. Should we be doing evaluations in-house? Should we be commissioning it to an external agency? When should we be doing these? And then once a decision to commission has been made, how do you also effectively make sure that you're commissioning it to the right organization and you're also effectively managing the evaluation? So these are the three components that we're going to be delving into. Next slide. Great. So again, so that we're all on the same page, I would like to start with a definition, because I think a lot of times we use words in monitoring and evaluation sort of very loosely. And I do want to highlight that in this lecture, and I think for most of us who are here, when we're thinking about evaluation, we're not thinking about sort of the layman term of evaluation in terms of making some sort of judgment about something even as basic as, when I go to a restaurant, I'm evaluating something, or if I take a flight and there's an assessment I have to do. That's not the sort of broad evaluation bucket that we're looking at, but we're really thinking deeply about program evaluations. And so when we think about program evaluations, it's really a systematic and objective assessment of a project, and this could be ongoing or completed, and try to understand what is the relevance of this program, how is it fulfilling its objectives, how does it fare in terms of the efficiency it achieves, its effectiveness, impact, as well as sustainability. And so some of these terms are might be familiar to you. These are the OECD, DAC evaluation criteria. And so these are sort of the broad things that we're trying to understand. And I think if I had to put it simply, what we're really trying to understand through a program evaluation is how is a program doing. And as I said, what's really important at the end of it is how is it being used to inform decision processes. And so we want to make sure that whatever program evaluation that we're doing, at the end of the day, it's providing information that is credible, and it's also useful. Next slide. Okay, I'll move ahead. Okay, so I think when we think about program evaluations broadly, you can think of them as answering three kinds of questions. These could be descriptive questions about sort of the situation that exists. These could be normative questions in terms of what should be, and this could also be cause and effect questions. So this is just a broad categorization. And at the end of the day, really, what's very, very important for an evaluation strategy, and this is sort of the first and foremost thing that we need to think about, is how can we identify the type of evaluation that's necessary to answer the given policy question. And so that's what I'm going to do in the first part of this lecture, really help you think through, I think, again, sort of demystifying sort of all of the terms that we use, but at the end of the day, saying that if I have a given policy question, what kind of evaluation should I be doing? Next slide. Great. So I think broadly, we like to think of these five kinds of evaluations. And I'm going to talk about these in detail as to how these different kinds of evaluations help us in answering different policy questions. So I'll start with needs assessment. And so needs assessment is essentially is a systematic assessment of trying to understand what really is the problem. We can move to the next slide. Yeah. So needs assessment is essentially a very systematic approach to identify what exactly is the nature and scope of the problem that we're trying to solve for. Who are the sort of target population that needs to be served, and also it helps us try and understand what kind of product or service needs to be provided to meet the problem. And so for each of these evaluations, I'm really going to flesh out what are the policy questions that this kind of evaluation is answering. So a needs assessment is essentially answering questions like, does the problem that we are proposing to solve actually exist? And again, this may seem like very obvious, but this has happened lots of times that you assume that a problem exists, but when you go into the field and actually do a systematic situation analysis, you realize that perhaps the problem itself does not exist. The second sort of degree question is, what is the likely source of the problem? And here again, I know the kinds of problems that we are looking at in the development sector can be so broad, and they're usually multi-pronged sort of sources of those problems. But I think definitely we want to, through a systematic needs assessment, identify the top 3-4 sources of a problem. Through needs assessment, it's also useful to do some sort of a landscaping in terms of what are the other programs that are trying to solve for this problem, what already exists, also what was previously tried and perhaps failed. And then the last question really is, who is really most in need for this problem, right? So within sort of your target audience, is this problem more acutely felt for women? Is it more acutely felt for children? Those are also very important questions to identify. And so all of this together, really informs the use of this kind of a study. And as I said, this could be called a needs assessment, this could be called a diagnosis, a situation analysis. And it helps us rethink the design of a program, or helps us design a new program. And so there could be several pieces of information we get from this. You could, for instance, realize that there's no problem, there's no real problem. You could even realize that it's not really a local priority given the geography that you're working in. Perhaps it's not salient enough. Or the causes of the problem are really different from what you want them to be. Hello? Okay. And so eventually what a needs assessment helps us to do is, it really forms the basis of a good program design. And this can actually also give us very useful information on existing programs, right? Why they're failing, why they're not working. Next slide. So I'd like to talk about this through an example. And suppose the problem that you're starting out with is the issue of a high incidence of waterborne disease, such as diarrhea, in a particular district. And so this is a problem that you have diagnosed, but you're still not sure, one, whether the problem actually exists, and also what really should your program be. So you want to try and understand what are the sources of this problem. Right. And so you could do this through several ways. You could conduct a household survey to understand what is the source of drinking water that they're using. Is the water being treated before consumption? You could do structured interviews with households. You could also do this with health department officials to understand how many houses have tap water connections, what's sort of the prevalence of waterborne diseases according to administrative data. And you could also do focus group discussions with the target population to understand what is their knowledge of waterborne diseases, what are the practices that they are currently adopting. And so this needs assessment could throw up different answers, which would help inform the program that you finally design to solve for this problem. Next slide. Okay. So the next kind of evaluation that's really important is then, once you have designed your program-based, once you've done a needs assessment, what kind of program or intervention do you design? And then how will the program, in theory, really fix the problem? And so that's what you do through what we call a program theory assessment, or also called a theory of change, which is essentially a way to model the blueprint. It's a blueprint to model the theory behind the program. And so you essentially have a causal pathway to see how the inputs and services that you provide as part of your program are delivered on the ground, how in the form of outputs, how those outputs translate into outcomes for the beneficiaries, the target audience that you have in mind, and how then do these outcomes meet the final program goal that you have in mind. So in terms of the policy questions that a program theory assessment or a theory of change helps you answer is, what goods or services will be provided in the program, what is really going to be the pathway to change from the goods and services to the outcome of interest. And also along the way, it's very important to think through the assumptions. And since you've done a needs assessment already, potentially try and understand and flesh out the theory of change. How does this particular program or solution address or avoid existing programs' shortcomings? And so the theory of change is a really, really important tool to understand what are the causal links, and it forms the basis for any kind of subsequent monitoring and evaluation that you do of the program in terms of identifying what are the main indicators that I need to measure for the program. Next slide. And so again, we'll just move ahead with the same example. And so if you're trying to solve for this problem of waterborne disease, based on the needs assessment that you did, perhaps the solution that you come out with is that you want to provide chlorine tablets or chlorine solution to households to treat water. And here again, you may arrive at the solution, you would arrive at the solution based on the needs assessment that you have done, where perhaps you would have gotten information on how there are awareness campaigns that are happening that are not working, or there are other kinds of interventions to solve for this problem that are not working, and this is the solution that you come out with. And so through the program theory assessment, as I said, you will map out the causal pathway as to why this particular intervention of providing chlorine tablets will actually reduce the incidence of waterborne diseases. Next slide. Okay. Then the next kind of evaluation that I want to talk about is a process evaluation. And process evaluations are extremely important to understand what is the effectiveness of program operations, implementation, and service delivery against what you set out to do, against what was decided. And so it answers really, really important policy questions that I think, especially for government departments, a lot of times where there are several programs which have been in operation for some time, it's very, very important to go back and do process evaluations to understand whether the program is being carried out as planned. Is the intervention really reaching the target population, not just in terms of just delivery, but also is it reaching it at the right time? Is the intervention actually sort of being completed entirely, right? Because for several of the programs, given that they are so complex, it's not just about delivery of one particular service, but there are so many other components that are happening simultaneously. So are all of these completed well and efficiently, and also to the beneficiary satisfaction? How are the program staff working? And also questions on whether the money is being spent efficiently. In terms of use, process evaluations are really, really critical to understand whether the program is being implemented the way it was supposed to be. Next slide. So again, taking the same example, perhaps now that you're implementing this program where you're distributing chlorine tablets to households, perhaps the water and sanitation departments wants to understand whether the program is functioning well, and whether it is being implemented according to the plan. And so to do this, you would want to do a process evaluation. So perhaps, do a household survey, go to the beneficiaries and try and understand whether they received the chlorine tablets, whether they received them on time, how are they using the tablets, are they just using it for, say, the first few weeks, or are they using it regularly? So all of these are important sort of questions that you would ask in a process evaluation, which would give you information on how the program is being implemented on the ground, right? So for after the process evaluation, for instance, you could have results like these, where you were able to see that 80% of the beneficiaries are receiving it each week. And then so this information also helps you sort of go back and then strengthen the evaluation, strengthen the program, see where are the sort of gaps happening, and accordingly make changes to your intervention. Next slide. Okay. The other kind of evaluation that I want to talk about is an impact evaluation. And what an impact evaluation tries to do is to measure the effect of a program on an outcome of interest, independent of any other intervening factors. So whenever we're talking about impact, it's essentially a cause and effect question, where am I able to say that my program led to X percentage reduction in diarrheal incidence. And this number, this X percentage, is really attributable to just the program that I was implementing and not to any other factors that might be there. So the policy questions that an impact evaluation question helps you answer is, does the program, first of all, just in terms of, is it even leading to any change? What is the magnitude of that change? And also several times in impact evaluations, you can also test sort of different elements of a program, which can inform the program design. And so even trying to help you understand whether just providing chlorine tablets in and of themselves are effective, or is it more effective if you give chlorine tablets along with some kind of awareness campaign? So impact evaluations are really, really critical to understand if a program is working, and also what is the magnitude of that change. Next slide. And I want to spend a little bit of time even talking about how do we measure impact. So measuring impact is not very trivial, and when you want to measure impact, you really want to look at the difference between the outcome of interest some time after the program has been introduced, to what is the outcome at the same point in time had the program not been introduced. And this is what we call the counterfactual. So this is really the ideal way to measure impact. Next slide. And I know we wouldn't be able to sort of pose this as a question to the audience, but I think this is something that a lot of times we end up seeing, right? We have some sort of trend data on a particular outcome of interest, right? So suppose this data over here is telling me what is the diarrheal incidence, and the vertical line over here is really the point where my chlorine tablet distribution program started. And I think a lot of times, if somebody were to look at this data, they would say that okay, and actually, I'm sorry, this is the diarrheal incidence should be, because it's a negative outcome, it should be falling. But let's assume this is a positive outcome. So suppose this is a sort of a good health outcome. And you might say that because the trend is increasing, impact for the program is positive. Okay. But really what we want to be able to see, to be able to measure impact, is what is the counterfactual? What would have the outcome been if this program had not been implemented? Next slide. And so this piece of data is what's missing. And it's only when we have this piece of data that we're able to say whether the impact is positive or negative. And so here, for instance, assuming that this outcome that we're measuring is a positive outcome, and so let's take another example. Suppose we're looking at immunization rates. And so now that I have information on what the counterfactual is, I'm able to say that the impact is content. Also have a situation when you was next. I think you could have a situation where
Megha, we couldn't hear you for last couple of minutes.
Okay, can you hear me now?
Yes, we can hear you now. If you can just repeat this slide, yeah.
Can we move to the next slide? Great. So I think this is a very sort of compelling illustration, because here you have a situation where even though your outcome of interest that you're trying to improve is increasing, you could have a situation where in the absence of your program, your target audience might have actually been better off. And so even though you see a positive trend, the impact really of your program is negative, which is why it's really, really important to have a counterfactual to be able to measure impact. Of course, in the real world, a counterfactual does not exist. We cannot have a parallel universe where we can clone people to see what would have happened to them without the program. And so a lot of all of the impact evaluation methods that we typically apply really try to see how can different comparison groups be created that are as close as possible to the counterfactual. Next slide. And we'll talk a little bit about these methods as well. And finally, the last kind of evaluation that I wanted to talk about, which is really sort of the next step after an impact evaluation, is cost effectiveness. And so through a cost effectiveness evaluation, you can compare the impacts and costs of various programs that could have been run in different contexts, different time periods, but they're really trying to achieve the same objective. And here, I think I'd like us to go back to the first example that I started with in terms of how can we improve learning. So you could have different kinds of programs that you have tried, you have evaluated. And then in addition to just the impact, the improvement in learning, you also want to understand what is the cost associated with running the program, because particularly for governments, it's about trade-offs and how you can best invest your resources. So you also want to see that for the same amount of money, which kind of program is giving you the most impact. And so a comparative cost effectiveness analysis allows us to do that and really choose an ideal program and see which program would actually be good for scaling up given the impact and cost associated with it. Next slide. And so we actually have, for this problem of waterborne diseases, for diarrheal incidents, there are several interventions that we evaluated. These are from different parts of the world. So you can actually see that the most cost-effective intervention here was providing free chlorine dispensers at water sources. So while, for instance, in our example, we were saying how can we give free chlorine tablets or solutions to households, evidence has shown that by providing it at the source itself, at the point where the water, where different households can go and collect water, providing a chlorine dispenser there where it's actually accurately measured and it's definitely going to be used, that's the kind of intervention that's most cost effective. Next slide. So this is really just, I think I want to summarize the different kinds of evaluations I just took you through and emphasize how first and foremost, when you're thinking about an evaluation strategy, what you need to think about is the policy question or the type of decision making needed. And that should define the kind of evaluation that your department needs to conduct. And so the kinds of decisions that you may need to make would be, how do I design a new program? And here the kinds of evaluations that you want to do is a needs assessment. Perhaps you want to do impact evaluation of programs at a small scale, on a pilot basis. You want to do feasibility studies. If you're trying to decide how can implementation of existing programs be done, you want to do process evaluation, you want to perhaps do beneficiary satisfaction assessment. So really, I think this is sort of the key thing that we want to make sure that our evaluations that we use are aligned with the decision making that needs to be made. Next slide. Great. And now I'll spend a little bit time on, once you've decided what type of evaluation you want to do, you also need to choose the exact method or technique you will use. And here I'll talk specifically about impact evaluations given Jaypal's experience in doing randomized evaluations. But this is, of course, true for other kinds of evaluations as well, that you would typically have several different methods that you can use. So in impact evaluation, as I mentioned, that you have different kinds of methods of varying degrees of rigor. You have experimental methods, such as randomized evaluations. You have quasi-experimental methods. And you, of course, also have non-experimental methods like pre, post, and simple difference. And so how, even after you've decided that if you do an impact evaluation from this universe of methods and techniques that exist, how do you choose from them? And here I just want to say that there are sort of two broad lenses through which you can look at this. Next slide. So I think one lens is, of course, thinking about the technical feasibility of different impact evaluation methods. And these are just sort of some examples of the criteria that you could take into account. So for instance, if you think about a macro policy, which is going to affect all of the population in the country, you cannot evaluate policies such as these based on a randomized evaluation. Similarly, if you're doing a program such as NREGA, which is where everybody is eligible and you cannot randomize people into treatment control group, you may not be able to do that through an RCT. The second kind of criteria that you want to look at is data availability. What data already exists, also what data can be collected. So for instance, if you are not able to get data for populations that were not part of the program, you will not be able to do certain kinds of methods, such as difference in difference. Or if you do not have baseline data available, then you would not be able to do a pre-post. Similarly, thinking about what kind of sample size do you have available, what is the time frame, what is the budget. So all of these are important technical criteria which inform what method to finally use. And equally importantly, I think, are thinking about strategic criteria. For what programs should you be using methods which are rigorous, which may oftentimes be costly, which may take time. So for example, if information from an impact evaluation will be used to demonstrate a promising development innovation as tested and proven. Suppose you're trying something which is extremely new, perhaps a more rigorous evaluation, such as an RCT, would be useful in demonstrating the causal impact of the program. But perhaps in some cases where there is a lot of evidence that already exists, or perhaps the program itself may not be politically feasible or palatable to the beneficiaries, perhaps for those kinds of programs, you do not want to invest a lot of resources in doing a very rigorous impact evaluation. So you could consider non-experimental and less credible methods to provide these results. But these may really be good enough for the kind of in terms of the strategic lens, what you're trying to achieve. And so I think just as an example over here that these are, I would say, sort of broad criteria that I've presented to you. And eventually it would be for the department, for the organization to think about how these criteria can be combined to establish sort of ways to think about which methods to choose. And just as an example, I think, for instance, the government of Tamil Nadu in its evaluation guidelines talks about how, when a rigorous impact evaluation should be done. So, if programs are above a certain budget of, say, around 150 crores, or if the programs are of strategic or critical importance to the state, or they are introduced on a pilot basis with the intention of statewide scale-up, those kinds of programs are where rigorous impact evaluations would be very useful. So these are really guiding principles for all of you. Next slide. Okay, and this is the last part of today's session. And once you've decided, what kind of evaluation to do, a key decision is to determine whether a particular study is to be undertaken in-house or whether it should be commissioned to an external agency. And several considerations go into this decision. And again, these are guiding principles, and it will really depend from case to case. So for instance, studies that require very complex technical and sectoral expertise, maybe in terms of the way indicators are measured or the kinds of methods that are used, these may need to be commissioned to external agencies with specialized skills. Then there's a question of size and scope. Depending on the government department that typically undertakes these studies, if they have low capacity, then perhaps they're better equipped to undertake only small scale studies in a small sample. And if you're doing large scale multi-district, multi-year evaluation studies, these might be best to commission to external agencies. I think things like sensitivities are also really important, right? So for instance, if you're doing a study which is evaluating programs that are targeted to vulnerable communities, or they involve some sort of tracking of gaps and leakages in service delivery or corruption, perhaps these would be better handled by the department in-house. And of course, there are several other sort of practical considerations, such as what resources are available, what's the time frame for the evaluation, which should also affect the decision of whether to undertake it in-house or to commission it to an external agency. Next slide. So this is a broad overview of the stages and steps involved in managing and commissioning evaluations. I will not go into detail of all of them. That would need another hour. But I do want to highlight a few critical aspects as you go through this process of managing and commissioning evaluations. So the first thing I want to highlight, next slide, is that the decision to do an evaluation in-house or through an external agency need not be a binary one. So even if you decide to commission it, you could potentially be commissioning only a certain part of it, and you could be responsible for certain components. And again, this really depends on the nature of the study, as well as the capacity of the government department that's undertaking these evaluations. And so these are, again, just sort of guidelines. As I said, this would really depend from department to department, but typically I think it's useful for the government department or the commissioning agency here to decide on the broad objective and scope, potentially even the methodology, research methodology that needs to be used, the sampling strategy. You could provide inputs on questionnaire development, but sort of more broadly with the external agency playing a more intensive role. And things like data collection, data quality checks, data analysis are typically commissioned out. Next slide. And the next step, important step, is really for you to define the terms of reference. And as most of you would be aware, this terms of reference document really contains all of the details pertaining to the objectives, scope, methodology, and expected outcomes of the evaluation to be undertaken. And this really is, I think, more of a guiding document for all decisions to be made. And this is important irrespective of whether this is this evaluation or study is being conducted in-house or it's being commissioned to an external agency. And this sort of provides the basis for the next step, which is translating the terms of reference into a request for proposal. Next slide. Yeah. So once you have your TOR in place, which sort of provides the broad overview of the study, you need to have an RFP which solicits proposals from external agencies. And here again, I don't want to go into each and every component of this, but highlight a few things that it's very important to think about. How do quality and cost sort of figure in your selection criteria? This, I would say, again, depends on the level of technicality of the study. So potentially for a highly technical study, you might want the split between technical and financial proposal to be 80-20. Similarly, when it comes to costs, and if it's a kind of study where there's a large variation in costs, perhaps you need to have a higher weight to the financial component of it. It's really important in the RFP to indicate what will be the role of the commissioning department with vis-a-vis the external agency. And as I said, this will also depend on the technical capacity of the department itself. Next slide. Okay, and so I think these are just some guidelines on how when you get responses to your RFP, what are the kinds of criteria you should look at for assessing the technical proposal. And I think these are sort of like 5 really, really important things to look at. What is the methodology that the external agency is using for sample selection? What kind of field plans and timelines that they have for surveys? What are the quality control measures that they propose? Eventually, your study is going to be only as good as the quality of the data that's collected. So this is really, really important. What kind of data collection experience they have? What are the qualifications of personnel? And here I want to add that it's really important that given the kind of study that you're doing, that there is not just there are not just people who are technically sound, but there is also some domain expertise that is reflected in the proposal. And fifth, and I think really, really importantly, I think having an opportunity for external agencies to give a presentation to the government department, have a round of questions and answers it's also very, very critical. Next slide. And I think the last thing I want to highlight in the whole commissioning process is that you really need to have quality standards to ensure that the evaluation that is being commissioned out provides accurate and useful information, that it complies with procedural requirements within the government department. For example, how are the communication findings, how are the findings going to be communicated along with technical requirements and ethical guidelines. And so it's really important for the government department to be involved even after it's been commissioned out. And here you can think of sort of different, these are just examples of points in the during the study where you could come in. So you could, for instance, provide inputs in the questionnaire development, even if you're not developing the questionnaire itself. You could be closely involved in sort of monitoring and supervising the survey itself, depending on the technical capacity of the government. You could also potentially do quality checks of the data collection that's happening, and then finally, of course, in terms of providing key inputs on the analysis and report writing. Next slide. Okay, and so I think this is, I don't want to summarize all of the different aspects that I've talked about in today's lecture, but I think finally just close by saying that a lot of the times you're thinking about how to have good quality, how to do good quality evaluations, but something that's really, really important to make all of this happen is a strong monitoring and evaluation system. And here, I think a few thoughts on how this comprises both having a conducive and enabling environment where there is a commitment to evidence-based policy making at the highest level, where you have documents and strategies, be it in the form of an evaluation policy or evaluation guidelines, like several states in India do, thinking about how you have a formal data policy, even things like how you can have incentives for research collaborations. A lot of times, I think both for in-house and for commission studies, departments find that it's useful to have some sort of external expert, say from a local university or somebody who can provide inputs as the study is being conducted. And I think lastly, but really important, is how to make sure that evaluations are integrated in the program life cycle and they're actually used for decision making. And then parallelly, I think a lot of operational aspects, which are again equally important, thinking about the knowledge and skill sets of the staff in the government evaluation departments. I think both in terms of doing evaluations, but also a lot of times, given that you will be commissioning studies, how can you assess the quality of different studies, get in external experts, how can technology be adopted, say, through using digital data collection methods to have better quality studies, as well as sort of smoother commissioning process. And I think this is just broad, but I cannot sort of highlight more that it's a lot of times we're doing, so many of us, and there, I think so many of you who joined from state governments, there is so much of knowledge and resources that exist in terms of toolkits, manuals, templates that exist, and how that can be used, shared and used to really simplify the process. And I think I want to give a shout out to DMEO, who's also trying to do a lot of this knowledge sharing. I think that's really, really critical into strengthening M&E systems for governments. So that's it from my side, and we can.
Thank you, Megha. Thank you so much for such an insightful presentation. I think it has raised a lot of curiosity among all of us, and we can see that there are a lot of questions which have come in. So if maybe we can jump straight into the questions, and we have just 8 minutes, so we'll be able to take only a couple of questions. So the first question, maybe which is very relevant to what you were just sharing, is by Sonal. She's asking how to balance between short policy windows and the time taken to produce good quality research.
Great. That's a fantastic question. And I think as JPAL, that's something that we get asked quite a lot. So I think one thing that I want to say is that the length of an evaluation, I think one thing that you should take into account is that a lot of times it's determined not by the method, but by the outcome that you want to measure. And there is always going to take that much time to be able to see the kind of change you want to measure, right? So for something like adoption of, say, chlorine tablets, perhaps that's a change that you can see in a relatively short time frame, and something like that can actually be done in a few months. For learning outcomes, you typically, most evaluations look at it in the time frame of 1 year. But if you're looking at programs which are, for instance, trying to change attitudes and behaviors, right? So even things which are very, very sticky, for instance, gender attitudes, an evaluation would have to take that much time because those things don't change so quickly. So I think that is just one sort of point that I want to make, because a lot of times we get confused between the method and the we conflate the method and the time that it takes. But to your point, I think I completely understand that for governments, it's really important to make sure that the evidence is coming in sort of at the right time and is being used effectively. So I think a couple of things. One, on operational, from the operational point of view, I think there are several ways to even make the evaluation cycles sort of shorter, right? And I'm sure you all have your own experiences that if you're doing the study yourself, the amount of time it takes to, put together the TOR, to commission the study, to get all of the processes in place itself can take so much time. And I think a lot of times if some of these processes themselves are strengthened, that can reduce the time it takes to put together an evaluation. The second is, I think, I feel like administrative data can be sort of really, really leveraged and can potentially be used to sort of reduce this, the time that it takes, because again, with data collection, it takes a lot of time. And if we can increasingly, use a lot more data that the government already has, administrative data, I think that's another way wherein the sort of the cycle can be, we can make sure that we are generating evidence which is fast enough to meet. And then I think the third point is, of course, like going back to my sort of the first point, that I think it's all about the question, right? So perhaps for some of these questions, you don't need to do an impact evaluation, right? If you want to just understand, is my program working well in terms of, delivery, in terms of implementation, then even doing like a process evaluation, which can be done over a few months, is good enough. So that's what I'd like to end with.
Yeah. And related to the same efficiency in the evaluation cycle, Charlo is also asking a related question. And I think it's also more of a comment on how we can function within government is if there are cases where, say, 15 to 20 schemes which actually target the same objective, in that case, what are the best practices maybe we can adopt to either evaluate one scheme as a proxy or evaluate all the schemes together, where the particular beneficiary unit or cluster is being targeted by various interventions.
I see. So I think here again, I think thinking about some of the strategic criteria that I spoke about, right? And I want to here, I think, make a case for the fact that there is so much of knowledge that we already have. And I think typically one just assumes that if there is a program, there has to be some sort of evaluation, right? But perhaps that those kinds of programs have already been evaluated and we know that they work or we know that they do not work. So I think here, even having, I think, more knowledge, and this is something that we do quite a bit of, that, telling policymakers that these are the kinds of interventions which have been found to work, these are the ones which have not been found to work. I think having that knowledge can really make this a much sort of more structured exercise where you are doing, rigorous impact evaluations only for things which are very new. So where things have already been established, have already been proven, then perhaps, as I said, you do not need to do an impact evaluation. You need to do other kinds of evaluations.
Sure. I think we are running out of time, but I just want a quick comment from you on something that a couple of people have asked. Is one, that is it more credible if an external agency is conducting an evaluation? And if we are actually commissioning that evaluation, what are the ways in which we can ensure that the data quality is actually up to the mark? What are the quality assurance measures that can be adopted?
Yeah. So I think here again, it's I mentioned this in my slides also, that I think you have to think about what is sort of the capacity, technical capacity, as well as, I think, staff capacity to undertake certain kinds of studies and use that. But of course, at the end of the day, I think there is sort of a little bit more credibility that comes when it is done independently. But I think here also, let's not keep it binary that it should be either internal or independent, because even if you're getting an independent evaluator, it's very, very important for the external agency to work very closely with the implementing organization, with the department. And here I would say that it's also very important that it's not just a conversation between the external agency and the evaluation department, but the line department who's actually going to use the results of this. So they should also be sort of in the loop and very, very involved in the study. The second part on the sort of quality control measures, I think one, of course, I think there's a lot more efficient government departments can potentially be in the whole a process of selecting, right? And so I think even some things like perhaps having impaneled agencies who you've already sort of reviewed, and you already have a list of really good quality agencies, and then using that as a pool to finally commission studies. Otherwise, I think every time you're doing a new study, if you start calling out for proposal, it becomes quite a overwhelming exercise. So that's one way where you can spend in, I think, a lot more energy early on to get good quality agents, impanel good quality agencies. And of course, once an evaluation is happening, I think, and I also made this point, that it's very important for the department, the commissioning agency, to be involved. I think if you have the technical capacity and the bandwidth to do this, be involved in some of the sort of like monitoring of the data collection. So, you could do data quality checks, such as spot checks or back checks. And even if you are not able to do it yourself, I think having that sort of line of communication, or as I said, even an external expert who can provide inputs and look at the evaluation that's happening is a good way to make sure that the quality of the study is good.
Thank you, Megha, for your patience with our questions. And unfortunately, we can't take any more questions. We are already at 5:30. Which brings us to the end of our scheduled time. But we'll be happy to engage beyond this platform as well. If there are any questions which we have not been able to answer today, we would be happy to take them over email. You can reach out for any further questions, comments, or interest. You can reach out to Shweta at shweta.sharma82@nic.in. You can also see the email ID on the screen, and sohini@ifmr.ac.in. We would also be sharing the presentation and some additional background readings with all the registered participants. With that, I would like to thank JPAL Clear team for collaborating with us and bringing together this session and raising our curiosity about evaluations. I would also like to thank entire DMEO Conversation Series team for their hard work in the background before and during the session, as well as DMEO senior leadership for their support, guidance, and encouragement throughout. Above all, thank you to you all, our audience, for attending and participating. As you leave this session, you will also be redirected to a feedback link. We look forward to receiving your feedback on the session through that link and hope we are able to make the series better with each session. Once again, this session is part of DMEO Conversation Series, which is a platform to discuss the insights from intersection of theory and practice of monitoring and evaluations. If you would like to partner with us, please write to us at dmeo-partnerships@gov.in. If you would like to know more about us and future sessions, follow us on LinkedIn or Twitter for our latest updates. Thank you, and wishing everyone a great weekend ahead.
Thank you.